Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back and taking your calls, speaking about patients, learning about cancer, providing information for you to have a smarter, better life. One of the most disturbing cases I saw this week was an investment banker came to us, 57-year-old man, single with no children. His PSA has been rising. It went from 2 to 4 to 6, and in December it went up to 10.4. Now, he's had multiple biopsies over these years, and they were all negative until the last biopsies, which showed a Gleason 6 cancer. So, had a Gleason 6 cancer, PSA 10.4. Now, PSA is the blood test, prostatic-specific antigen, and for men with prostate cancer, if it hits 10 or higher, it's actually higher risk. So, the fact that his PSA got over 10 puts him in a new category, a higher risk category. He had Gleason 6 in several cores. His doctor in a Manhattan hospital, one of the smaller hospitals, gave him Lupron, which is a hormone agent to reverse or negate testosterone. Then he went to a big doctor at a big hospital who wanted to do another biopsy. Now, why would he do another biopsy? The patient already had biopsy-proven cancer, and he was also at a higher risk because his PSA was 10.4. So the patient had his fourth biopsy, and the fourth biopsy now shows a Gleason 7 cancer. Well, we know that men with prostate cancer of biopsy have about a 30% chance of having higher risk cancer if more tissue is obtained. So this doctor told the patient he was the best, and the patient asked for data, and the doctor told him, "My data is smoking. It's smoking. It's smoking out robotic surgery." Well, the patient asked a question, and he got a baloney answer. He asked for the data, and smoking is not the data. Smoking is a deception. The patient wants data. The urologist said he had 4 to 5,000 cases, but he refused to give the data. Why? Because there's a lot of work to do the data. To follow thousands of patients over decades is a lot of work. So rather than doing all that work, the urologist just said his data was smoking. Well, to me, that's smoke and mirrors and malarkey. The fact is, if this man with a Gleason 7 cancer had surgery, he went to this famous surgeon, and you can look at our data, not for this surgeon who's never published his data. I wonder why. Well, I think I know why, and that is because it's too much work, and the data would show ugly results. For Gleason 7 cancer, and you can look at our data, one of the most famous surgeons in America in Baltimore, the cancer-free survival for Gleason 7 is 66%. Wait a second. If they remove all the prostate, how can it be only 66%? It should be 100%, right? But it's not. And it's not because just like when you cut a bread, there's crumbs left behind. When the surgeon removes the prostate, they're leaving crumbs behind. They may not know they're leaving crumbs, but why else would the cancer-free survival after surgery by the most famous surgeon be 66% at 5 years, and at 10 years only 46%? Lousy data. Compare that to our data with a 90% cancer-free survival for Gleason 7 cancer. So if you had prostate cancer, would you want to go to the famous doctor who's telling you his data is smoking when we know it's only 60%? or come to us and learn about your options and see our data published in a book with 90% success. And by the way, if he looked up his data, which is in our book, page 6, the most famous surgeon in America doing prostatectomies for PSA 10 to 20, and this man had a PSA 10.4, so he's in that category 10 to 20, the 10-year chance of being cancer-free after radical surgery is only 30%. So, men and loved ones, if you have prostate cancer or are thinking about treatment, you might want to look at the data first before you make a decision. This man had a change of heart Friday afternoon when he looked at the data and he saw that his 10-year survival with radical surgery would only be 30%. And if he turned to the back page, page 14, inside back page, how many people have no sexual problem after surgery? 3%. How many people have sexual problem after radical surgery? 97% in the data from Harvard Medical School. How many men have no urinary problem after surgery for prostate cancer? 19%. How many men have a urinary problem after surgery? More than 80%. And actually, the group that had robotic surgery did worse. So it was all hyped up to do better, promising us better data, but in fact, the data for robotic surgery is worse with more sexual problems and more urinary problems. That's documented in our booklet. And again, we have a completely new prostate cancer booklet, which we will send at no charge to you. Just call us at 212-CHOICES. For this man who was told their data was smoking, I think their data is up in flames, useless. We have Gary on the line about the VA. Good morning, Gary.
All right. Good morning, Doctor. Great show as usual. Let's
Thank
just hope
you.
this guy. Let's hope that doctor's not teaching calculus at Harvard or anything. But his
well, that doctor is a full professor at one of the biggest medical schools in New York. He's done 5,000 cases, he says, and he tells people his data is smoking. But we want the facts. Smoking is baloney.
Especially when you're dealing with medical terms, you would prefer to have, like you say, the actual facts.
You want the data. I mean, why is it so hard to do the data? I mean, he's been in practice like me 30 years. We started out collecting the data. Why can't he?
Right. And talking about collecting the data now, Doc, I know you read the papers, you're very well informed. The veterans hospitals, you hear all this, coming up with all these facts, and they're talking about maybe they might be cooking the books about what they're doing over there.
Well, we talked about that at the beginning of the show. Did you hear that?
I just caught on the last part of the show. I know you're not supposed to say that, but I figured you would touch on that.
Well, I did touch on it, and, the whole issue here is, how do you want your health care? Do you want a private doctor who's responsible for you, and if you're sick, you know his phone number, and you can call him day or night, 24/7, you can come in and see him, or this article in the New York Times, and it actually outlined what was going on. There was a doctor named Hollenbeck who reported that the Jackson Hospital did not have enough doctors, resulting in nurse practitioners handling too many complex cases when they should have been taken care of by doctors. In Phoenix, there was falsified data, so they were trying to handle patients, and they couldn't handle it or didn't want to handle it. They falsified the data. There were schemes to disguise wait times. In Phoenix, administrators were overwhelmed by patients, so the patients were not logged into the waiting list. So it made it look like there weren't delays when, in fact, there were tremendous delays. Another strategy was for employees to record the first date a doctor was available as the desired date, even if the patient wanted an earlier date. And they said it was gaming the system. Dr. Hollenbeck said in Jackson, hospital administrators created ghost clinics in which veterans were assigned non-existent clinics to make it appear they were receiving care. And in Albuquerque, an employee at the Veterans Hospital was shocked when they were told that doctors would get 20% of their performance pay doled out to doctors who found a way to limit patient follow-up visits to 2 a year, a tactic to reduce waiting time by persuading veterans not to come. And clinic staffs were instructed to enter, this is quote unquote, New York Times this week, clinic staff were instructed to enter false information into veteran charts because it would improve the data about clinic availability. There it is.
Right. And to me, Doc, this is not mind-boggling because I've always said all along, eventually the healthcare system won't be available to all Americans, and obviously it's not available to the veterans. And it's a ghoulish way of really doing cutbacks. It discourages people with nonsensical appointments 6 months down the road or very far away for an elderly person who can't have the transportation. So to me, it's a ghoulish cutback monetarily to do this to them. But also, these individuals who are behind this, these bureaucrats.
The individuals are your government.
Right, they're bureaucrats.
No, wait a second. Excuse me, sir. When Harry Truman was president, you know what plaque was on his desk?
The buck stops here.
Okay, so where is the buck stopping today?
It's not stopping anywhere.
It's not stopping anywhere. No one's responsible. We've got a president, 1600 Pennsylvania Avenue. Is the buck stopping with him?
Absolutely not. And unfortunately, for a lot of these Americans, this is just
Americans. These are us. These are us. These are our neighbors. And it's not only happening to veterans, as I talked about earlier in the show. Health insurance companies are now trying to pay hospitals a certain amount of money to dictate health care. Did you hear that part of the program?
Yes. And to me, I've always joked around, I've said for years, their ultimate dream with the insurance companies is to have the deductible higher than the actual coverage. But the bottom line is,
the ultimate is you don't show up for care, you refuse the care, you tell the patient you can't have the MRI, you can't have the PET scan, or then you pay the hospital $350 per patient per month to get their version of care, not the version of care that the doctor and the patient decide themselves.
Right, and these bureaucrats, if they crack a fingernail, they run screaming to the doctor for care. But people really need it. Like you said, us Americans, we're going to be denied coverage. I've said that all along. And Doc, your show is so refreshing. It should be a national show that you do.
Well, I'm trying to bring information to the public, how this is working. And it used to be you'd have your own private doctor, and you'd call your doctor day or night and see your doctor when you want and when you need. And your doctor would give you the information that he or she could best provide for your care, and they'd give you all the options. Now, when you have the health insurance companies paying back the doctors and paying back the hospitals to force them to give a certain care, that's not giving patient an option.
Right. Basically, you're making the bureaucrat actually the doctor then. To me,
you're making the bureaucrat the doctor. The bureaucrat is prescribing the treatment for the patient. That's exactly what I'm talking about. And people are screaming, I mean, it's so political. It's for Obamacare and against Obamacare and for this and for that. What they're talking about is when it's you or your mother or your loved one and you want to choose, you want to know the options. Why should I get chemotherapy if it's going to cause me to have brain damage? You know, why should I have standard radiation when Dr. Lederman can hit the cancer with radiosurgery? What are the options? I want the options, and I think morally a patient deserves to hear the options. And even if they're painful options, you should have the data, you should have the options, and you should be able to make the choice yourself.
I fully agree, and it's unfortunate a lot of Americans are more concerned about who wins the ball game or what. They'll shop around 10 different places for a new refrigerator or a can of peas, but when it comes to their own health, they'll just say, oh, is that what it is, Doc? Meanwhile, they should really, like you said, look at all your options, educate yourself on what's going on, educate with yourself on what kind of illness you have, and that's the only way to do it, and really have people you can fall back on who can help you if you're really sick. To me, I'm telling you, this is mind-boggling. But I've said it all along through the years, Doc. I said eventually Americans will be denied the health care. It'll be there for certain people, but not for everyone. That is not the American way.
All right. Well, thank you very much for calling, and I appreciate it, and keep in touch. God bless you, and thank you.
Great show.
We're going to hear from our sponsor, and we'll be right back.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from